The next keynote speaker will be Jennifer D. Sons. Thank you so much, Dr. Jennifer.
Good morning, everyone. Good morning. So good to see you all on this rainy, cold day. I obviously brought my little daughter. She's 4 years old. But a little bit about me. I grew up in Brooklyn, New York. And there were, everything that I saw, there were a lot of disparities in healthcare. My parents are from Guatemala, and so he was a practicing physician in Guatemala, and obviously when he emigrated here, he didn't speak an ounce of English, and so I saw the struggles that he went through. He didn't practice medicine when he ended up in this country. That's how I always knew that I wanted to do medicine. I wanted to impact those that, there are a lot of healthcare disparities. So for example, breast cancer, it affects a lot of women. 1 in 8 women get breast cancer, but it doesn't affect all women the same way. Underrepresented minorities, Hispanics, Blacks, African Americans, they end up doing slightly worse than their white counterparts. Why? Access to healthcare, racism from providers, and so we do not want that. We need to advocate for ourselves. We need to know what we're looking for. And so today I'll teach you a little bit about the breast exam, but I want you all to know that if you have a problem, breast pain or anything, seek medical advice. So in regards to breast cancer, we have to make sure we know our family history. We need to know, did our mothers have breast cancer or ovarian cancer, sisters, even in our father's side as well, because there are genetic mutations that happen that increase our risk for breast cancer, so we must know that. The other thing, we need to know the density of our breasts. That is only known on mammogram. So when should we start getting mammograms? Usually at the age of 40, and that's when we tell people to start. If you have a family history, like your mother or sister, you can start earlier. And the other thing I want to tell you guys about is breast density. Usually young women have really dense breasts, and that's common because you have more breast tissue, to supply milk. If you have really dense breast tissue, you can qualify for an ultrasound and an MRI as well. So make sure you're talking to that with your provider about that. So here we have a set of breasts. And it's important that we do our own breast exams, okay? We have our model over here. So always feel them once a month. I say feel it on the first, so feel it on the first of the month. Don't be afraid, they're your breasts. You shower, right?
Hello.
So make sure when you're feeling them, don't just go like this, because you may miss a couple spots.
You mean don't just slap it?
Yeah, exactly. So make sure you're feeling, roll your fingers like this, start from the middle, and go up and down, all around, until you actually have breast tissue all the way up here. It's called the tail of Spence, and so make sure you're feeling all of that. Usually breast pain is not a sign of anything. We do have breast pain that comes and goes and fluctuates with our cycle. But if you feel anything hard, like a golf ball, a pea, any new changes at the nipple inversion, any nipple discharge, something coming out of your nipple, if it's bloody, that should be a sign that you should seek some help. So do that on both breasts. I actually like to feel, I'm going to get real personal over here. Get in here. These are your lymph nodes. Make sure you're examining all that. The other thing is, men do get breast cancer. I see a lot of men here. That's wonderful support. Men do get breast cancer. Very rare, but they do.
Men.
That's tiny. Do the same thing. Again, but really, when I see it affects men, they usually see changes at the nipple. So something itchy, something painful, something, it looks like eczema, like dry, rashy, red skin. That's cause for alarm in men. So make sure you're looking at yourself and checking yourselves out. Okay? Of course. Can I take questions from the audience?
Oh, yes.
Questions?
Questions.
Can you speak on the different types of mammograms that are available now?
Yes, so we have 3D mammography now, which is what you're thinking of. Most places now do 3D mammography, which is looks at the X-ray in a 3D way, not just on 2 films. And so that's a little bit more thorough than your regular 2D mammogram. Most institutions now all carry that. But if they don't, make sure when you get your mammogram, say, I'd like a 3D mammogram, and it's covered. Okay? Yes?
So someone that has a breast implant, how do you check for breast cancer? Because sometimes you have a breast implant, so it's hard for you to see if anything is bothering you in there.
The question was, what happens if you have breast implants? That's okay. A lot of women have breast implants. They actually place the implant behind the breast tissue. So what's in front and what you're feeling is all your own breast tissue. Okay? So you still feel it the exact same way. Even if you get mammograms, they actually push the implant a little bit so that you can see the x-ray or the mammogram with just your own breast tissue. You can easily tell.
Frequency. Can you speak on the frequency of breast mammograms?
So I say start mammograms at the age of 40 if you're of average risk and keep going. They say stop at 75, don't stop. If you're healthy, keep going. If you have a great life expectancy, continue to get annual mammograms once a year. The new guidelines just showed that you should get it every other year. I don't agree with that, and insurance does covers it. So don't let your primary care provider say stop mammograms at the age of 75 or get it every other year. Not true. Get it once a year starting at the age of 40 and keep going.
Questions, men. Are men in the house?
Men don't get mammograms, so you have to examine yourselves. But if you see something, say something.
Okay.
Someone back there.
Okay.
I don't need a mic.
Oh, okay, you don't need a mic. Okay.
Does it matter when
No, they
you
can't
get
hear
your mammogram?
you. See, they can't
Before or
hear you.
after your menstrual cycle? Does it matter when you get your mammogram? Before or after your menstrual cycle? She heard you.
The question was, does it matter when you get a mammogram before or after your menstrual cycle? It does not matter.